Hi, my name is Dr. Josh Bross, and I'm a chiropractor here at Omega Rehab and Sport. We're going to do a quick demonstration here with Davey today about a technique, Graston technique and active release technique. Davey is a former baseball player, and he's had shoulder problems for about 6 years now. I've already done an exam on him. He's got a little bit of an impingement with a little bit of lack of range of motion in his right shoulder. So we're going to sort of go through it and show you how we fix these problems. So one of the things Davey's having issues with is horizontal adduction. And so go ahead and Davey, show your right arm here. And he's pretty limited. He feels a little bit of pinching up here and a little bit of tightness in the back of his shoulder. And now do the left arm. And the left arm, you can see he's got quite a bit more range of motion. So we're going to work on this and see if we can correct it right now. Pardon me. So these tools I'm using are called Graston technique, and it's a great way to treat soft tissue injuries. So the first thing I'm going to do is I'm working a little bit of the supraspinatus, part of the rotator cuff, and just looking for adhesions or scar tissue in the muscle that may limit a little bit of his range of motion and account for some of the pinching he's feeling. So we're going to do a pretty abbreviated version of this just for the time's sake. And you can see what happens was you get a histamine reaction in the skin, which is basically the skin gets nice and red, the blood vessels release histamine, so you have increased blood flow in the area. So we're going to just do this a little bit, and you can see he's got a little bit of petechiae, which is basically scar tissue being broken up underneath the skin there. So you can actually see the scar tissue being broken up as we go. So do a little bit more here. Okay. Now what we're going to do is we're going to have Davey go through the range of motion that is actually restricted, and we're going to do soft tissue while he's doing the range of motion. So go ahead, Davey. So I'm going to have him just pull his arm across, and I'm actually working the posterior capsule of the shoulder to try to free up any scar tissue, any adhesions, to try to increase his range of motion. And back, Davey. And forward again. And so what I'm doing is I'm trying to feel, keep going. I'm trying to feel for any changes in tissue texture